Hi everyone, and welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tan Yiping, consultant obstetrician and gynecologist. So today's topic was requested by one of you on teenage menstrual problems. Teenagers, this is always the biggest worry of a lot of mothers, especially. A lot of mothers, they have something about them. They always can't really remember what happened to themselves when they were teenage. So every time they feel something is not right with their daughter, they get very worried and they will usually bring them to see a gynae. So today I'm going to talk everything about teenagers, especially their menstrual problem, because there's so many possible things that can happen to a teenage, especially when it comes to their menstruation. So why is it that teenagers have a little bit more problem with their menstruations compared to other matured women? So it is again a phase, you see, it is a phase, the beginning part of the menstruation. So for teenagers, same, there are some problems. But at the same time, I have seen mothers who for so long never brought their daughters to see a gynae, even though there was actually a problem. They keep thinking that teenage should be normal, teenage should be normal, teenage should be normal, but actually it's not normal. And they only bring the daughters to come and see us like at a very, very late stage. So there are also issues with this, okay? So on one hand, we have parents who bring their daughters over every little problem to see a gynae. On the other hand, we have parents that just think that everything is just due to their teenage because of their age, that's why it's normal, but in actual fact it's not normal. So what is normal and what is not normal? So the first thing we need to define is when is normal and when is not normal. The thing is, how old should a teenager get her first menses? How old should your daughter get your first menses? When should you start bringing your daughter to see a gynae if she's not having menses or if she's having menses? So we have the minimum age and the maximum age of the first menses. So minimum age is, we say, you'll be surprised, 8 years old. If your girl get a first menses at the age of 8 or 9, that's normal. But trust me, you definitely bring her to see a gynae. Oh my God, she's only 8 years old. How is she going to manage her menstruation? That is the biggest worry that a lot of mothers have. They don't want their daughters to get menses so early because then they have to teach them how to manage their menstruation. But yes, even if 8 years old or 9 years old, first time menses is considered normal. But if you get menses before 8, that's not normal, yeah? That's not normal. 8 years old and above, that's normal. In fact, honestly, I've not seen 8 years old with menses yet, but 9 years old, we start to see them already. So now, what about the latest age? What about people who don't get menses at all? Until when can you wait for your first menses? The limit is 16. So between 8 years old and 16 years old. After 16 years old, if she still never have a menses, please bring her to go and see a gynae. It is not normal not to have menses after 16 years old. So that is the onset of menstruation. But other than the onset of menstruation, a lot of things that still stresses a lot of parents is not the menstruation but the breast development. Breast development starts before menstruation. So a lot of little girls already have breast buds as young as 6 years old. Oh, this is like the commonest reason for me to see a girl that comes into my clinic like 6, 7 or even 8 years old. Parents bring a daughter to come and see me, I already suspect that must be a breast bud she's going to show me. Because the beginning of breast development is breast bud. Breast bud is like a little bit of breast just at the nipple. It is quite hard and it is painful. They either bring to see me because they feel something hard and they're very worried, or they've come to see me because the daughter complained pain. Then they come and see a gynae because they're worried and it's so young. And every time I tell them, that's normal, that's breast bud, they're like, so young? That's normal. No matter how young you have breast bud, it doesn't mean you're going to have your menstruation soon. No. You can have breast bud like at 6 or 7 years old, but you only get your menstruation like 11 or 12. So it's normal. It's normal for early development of breast bud. And I always like to tell mothers, it is the diet nowadays. We tend to take a lot more estrogen containing products. So as a result, you see a lot of young girls with breast bud at a very early age. But it's normal. Don't worry. No issues at all. Other than that, you must understand that most girls, when they get their menses are usually very irregular. Most of them, it doesn't come on time. So don't expect your girl to be having menstruation every month. For the first 2 to 3 years, it can be so crazy. It can be twice a month. It can be 6 months once, 3 months once. It is all normal. It's so normal, okay? So you don't have to worry. What do you need to worry? You only need to worry if the menstruation never stops. It is still quite normal because their hormones are still not normal. So some girls, they actually can have menses for like the whole month. But if you're going to get like the menses for the whole month, every time, I would think that's not normal. And I seriously feel we should do something because menstruation disturbs your child. It disturbs her schooling, it disturbs her education. So it's better to just take some medication and stop it so that she can have a normal life. So that she doesn't need to worry about menstruation every day of her life. So if your menses is so prolonged, then you need to see a gynae. Number one is to check if there's any problem, and if not, then we also need to give her some medication to stop the bleeding. Then there is another situation where your menses is so heavy. When the child's menses is so heavy, you need to see gynae, even though it may finish like 5 days, 7 days, but it is so heavy. Why? It's because, number one, you won't want your daughter to have heavy menses every month. Some girls, because of the menstrual hormone disturbance, they actually have very heavy menses. But if you leave it alone, eventually there'll be lack of blood. They go anemic. Not enough blood to the brain. How do you expect her to concentrate on her studies? How do you expect her to do well in her studies? No, it will affect her. So if menstruation is too heavy, we also need to take medication to reduce it for your daughter's health. And there's another reason why you must see a gynae is some girls, they actually develop certain blood disorders, blood problem. And you don't realize, maybe they just complain, tired sometimes, maybe, but they don't have too much complaint, but they bleed so much. That is actually a sign. It can be a sign of blood disorders that cause her blood to be very thinned down, blood thinning disorders. Or it can also be things like leukemia, blood cancer. Leukemia is quite a common cancer among all cancer for teenagers, and it can present to you with just heavy menses. So when your child have very heavy menses, you must see gynae. Prolonged menses must see gynae. Menses that are disturbed, 2 months, 3 months, 6 months, 4 months, that's fine. Okay, that's fine. Alright, for the first 3 to 4 years. Usually my cutoff is 16 years old. By 16, most girls should be able to get a regular menses just like an adult. If by 16 their menses is still not regular, or already more than 3 to 4 years and is still not regular. So if you get your menses at 12 years old, by 16 still not regular, that's not normal. But if you get your menses only at 15 and you are 16, maybe we give them some time, 3 years later by 18, if they are not regular, you need to go and see doctor. Because when the menses is not regular after so many years, then we have to start thinking about situations like polycystic ovarian syndrome, which is something that can present by that time. Normally, when we look at menstrual disturbances, irregular menses, first thing we look at is the girl, what's her height, what's her weight. Usually when they're too tall, too short, too fat, too thin, we need to see if there are other reasons why their menses is still not regular at that age. So usually when menses are not regular, they tend to have certain bodily structure abnormality. Either they're too tall, too short, too fat, too thin. So in these situations, we need to investigate a bit more to try and understand why this child have irregular menses after so many years, because it is nice to diagnose them at 16 or 18 that she has polycystic ovarian syndrome, or we call PCOS or PCOS, which is very common because it affects 20% of women, and many of them, in fact majority of them, present as a teenager itself. They never had a single normal menstrual cycle before. They will always tell you, I've been having irregular menses ever since the beginning of time. So it's always nice to know them a bit earlier so they can do something to regulate that menstrual cycle, okay? The other feature to look at is, do your child or your daughter have a lot of hair? A bit like more towards a man, but not fully. Just a lot of hair over the legs, over the face, over the hands. Then we will also think about abnormal hormones. Then we need to check further and may need to give her medication. And it is important to try to give her medication younger than to wait for her to grow older, because I tell you, schools, friends, they like to bully other people. They like to tease other people. It's not easy to go to school with a lot of hair on your face and hands and legs and being teased by people. So it's better to see doctor earlier, to take medication so that she have a proper girl image. Then she goes to school, she don't get bullied. Talking about medication, my biggest hurdle when it comes to medication are mothers. Because trust me, all the medications are going to be hormones. Typically, most mothers don't want to give their daughters long-term hormone medication. But unfortunately, sometimes in certain cases, this is the only option. So that's all I have to say about teenage menstrual problems. So all you need to know is the first time menses, when is the right age, which is 8 to 16. And any form of irregular menses is normal as long as it's less than 4 years and less than 16 years old. And the only thing that you need to come and see a doctor is if it's more than 4 years irregular and more than 16 years old still irregular, or menses is very prolonged, or menses is very heavy. One of the things when we check on the teenager when they come to us with irregular menses, there's only one more thing that we need to look out, is to make sure she doesn't have a growth. Teenagers can have ovarian growth, ovarian tumor, ovarian cancer. So, and all these growth also present with abnormal menstruation. So what you will notice is, if of course you have prolonged menses, heavy menses, you come and see gynae, we will definitely do a scan. What else you need to look for? Look at your daughter's tummy. Usually what happens is the tummy gets bigger and bigger, because teenagers, when they get ovarian tumor, ovarian cancer, the tumor is very big. It's really very big. So you can see your daughter's tummy getting bigger and bigger. When your daughter's tummy getting bigger and bigger, the next thing you should see whether her arms are getting bigger and bigger, her thighs are getting bigger and bigger, her bum is getting bigger and bigger. If everything is getting bigger and bigger, of course she's putting on weight. But if everything else is still thin, but the tummy is getting bigger, don't always think that it's just fat. No, it's not fat. Your daughter could be having a growth in her tummy. So then, if you notice that the tummy is getting bigger, you need to go and see a gynae just to check. In fact, it's easier when you diagnose PCOS for teenagers. Because when you are a teenager, it is number one, a lot easier to lose weight. I mean, for those of you who have been following my videos, you'll know that I also have PCOS. And when I was a teenager, when I was in Form 5, I still remember, I was like 80 over kg. And within 6 months, I can lose 20 kg. Now you ask me to lose 20 kg, oh my God, it's so difficult. You know, it's so difficult to lose 20 kg when you're in your 30s and 40s, but it's so much easier to lose 20 kg as a teenager. So it's better to diagnose and know that you have PCOS at a young age. Then you can do all the lifestyle modification for PCOS, because they need to understand why their menses don't come, why are they so fat, and what they can do. Because many of us don't know and do not know the right way to bring the weight down as well. Because for PCOS, the way to bring the weight down is also very unique in itself. Many of them go on diet and the weight don't come down because they're not doing the right way of dieting, okay? When you come as a teenager, you will be able to solve the problem better. So as I say, by 16 years old, if you're still having irregular menses, please bring them to see a gynae to see if there's certain conditions that need something to be done. Teenagers' menstrual pain is normal. One day before menses, she has pain. It's normal provided there are conditions. You can go to my YouTube to look at this video on menstrual pain to have a better explanation. But I always say there are criteria. Number one is only 1 day. Number two, she doesn't need painkiller. Number three, she can go back to school. And number four, it is only in the center. It is the center type of pain. It's the center. Not left, not right, not back or somewhere else. Front, center. Then it's normal. If anything out of ordinary, that's not normal. That's not normal menstrual pain. Okay, so go to my video on menstrual pain to understand better. Yes, it is an early signal of menstruation. There's one more condition that I never mentioned yet so far. We call imperforated hymen. Some girls actually, their vagina got no hole, so their menses never come out. So if their menses never come out, actually they're already menstruating but it cannot come out. So typically these girls, they have very, very bad menstrual pain once a month. They really have this menstrual pain, but you don't see any menses, and it's very pain because their menses totally cannot come out. In that case, remember to go and see gynae. So that's why I say, of course, most of them, they will come and see because the pain is so bad and it's not menses. So the mothers never think about menstrual pain. They just know that the child got very bad pain, so they go and see gynae. So, but it behaves like menstrual pain. So that is another condition for abnormal menses. So pain, your daughter is having some amount of discharge. So I think menses is probably coming soon. You just need to monitor when she has her stomach pain. Just make sure that it's not once a month thing. Because if it's once a month thing, then we are a bit worried whether she could actually be having menses, but the menses is not coming out. But usually those type of pain are very pain, not small pain, okay? Alright, so I think that's all the questions you have for me today. So I would like to end my session today. So don't forget to go to my YouTube channel, Dr. Tan City Clinic. Remember to subscribe, yeah, and like my videos, okay? For those of you who want to know more about menstrual pain, please go and see that video, because I mentioned a lot about menstrual pain for teenagers, which is again a very important thing to understand, because to prevent a future problem. So, okay, that's it for now. So see you again next week, same day, same time. Bye bye.